I'm going to hand off to our first panel. Dr. Buchert is going to moderate our first panel, which is around payer alignment to support eConsult expansion. So Dr. Buchert will be joined by Bill Barcelona, who's VP of Government Affairs at APG, or American Physicians Groups. We have Abby Totten, the Medical Program Officer of HealthNet, and Joel Gray, who's Executive Director of Anthem Blue Cross, California Medicaid. Our panel today will address how payers across California and the US are collaborating to support their networks in participating in eConsult programs to improve access to care for their members. And with that, Greg, I think I'll hand it off to you to say a few words and get us started. Thank you so much.
Great, thanks, Libby. And it's a pleasure to be here. And thank you to Blue Path Health and all the sponsors of the program. This is great to get everybody together. You know, with this panel looking at the payer's role in supporting eConsult, it gives me a chance to reflect. And about a dozen years ago, I was the chief operating officer at CalOptima, a health plan in Orange County, California, that served about 400,000 Medicaid and Medicare members. At that point, we had a big difficulty and a big challenge as far as meeting our access and availability standards for getting access to specialty physicians to care for our members. Fortunately, at that time, I had the honor of chairing a community-wide organization called Access OC that was specifically created to increase access to specialty care by individuals and residents of Orange County. And at that point, we heard about Dr. Hao Yi up at San Francisco General Hospital and what he was doing with his early eConsult efforts that Chris mentioned earlier. And we're stunned to see that he was able to drive the waiting times for the GI clinic from 1 year down to 1 month. And we said, he's on to something. So we invited him to Orange County. We had several visits with Dr. Yi. And Access OC ended up sponsoring a group of very smart developers to help design our first eConsult program. And it was designed in Orange County, but fortunately, LA Care picked up the ball and really implemented it in Los Angeles County. And so a lot of things have changed since then. And fortunately, there's been a lot of great developments. And during that time, multiple health plans have adopted the use of eConsult and supported it, sometimes even requiring it for authorization for face-to-face visits. As you just heard, we now have CPT codes. We can capture these as encounters. We have some regulatory agencies around the country that are recognizing eConsults as a way of improving access and meeting standards. And probably most importantly, during this time, there have been many, many opportunities to enhance the practices of specialty physicians, educate primary care physicians, and really importantly, improve the timeliness and the quality of services received by the members served by all these health plans. So today I'm very pleased to manage this panel of some real outstanding healthcare leaders that have been involved in this for many years and have really led the charge on implementing eConsult in their various organizations. Each of them will speak for about 10 minutes, and at the end we'll have a question and answer session to make sure that all of your questions are answered and hopefully provide some insight into how to do things better in your own communities. And with that, I'm going to invite Bill Barcelona, the Executive Vice President for America's Physician Groups, to speak. And APG represents over 300 medical groups and IPAs across the country. And so Bill will give us a little bit more of insight into what's going on across the country. So Bill, I'll turn it over to you.
Thank you, Greg. Good morning, everybody. Thanks for having me, and thanks for including me in this panel. Greg, thanks for the introduction on America's Physician Groups. Just a little bit of background. I've been with the association for about 15 years now, running government affairs and policy development, both in California and around the US. I'm a lawyer by training and profession. I've been in practice for about 35 years in California, and I focused on healthcare issues for the last 20 years. Prior to APG, I worked for the Department of Managed Healthcare in the early to mid 2000s, and I focused on network stability issues, developed standards for the Continuity of Care Act and the patient block transfer processes. So you could say that my career has been focused on provider networks for the last 20 years. Certainly in 2020, the coronavirus pandemic presented our membership with several challenges. At the outset, I think all of our providers and our administrators thought that our organizations would be hugely challenged with a loss of workforce. We thought our doctors, nurses, NPs, PAs would all be coming down with the virus and that we'd have a huge problem handling patient access. Everyone assumed that we'd be swamped by sick patients. That obviously didn't occur back in March and April, and things have developed more slowly. In talking about the adoption of eConsult, you can't dislodge it from the greater concept of the adoption of telehealth. When we started in this pandemic, there was less telehealth adoption across the board by several large provider organizations. And the pandemic forced them to expand into telehealth rapidly. eConsult has followed that adoption, although less so than telehealth in general. But I'm hopeful that that eConsult adoption will ultimately follow in 2021 to a greater extent. One of the things about barriers to access for eConsult has been, I think, the general physician reticence about the adoption and usage of telehealth in general. This existed for a lot of reasons prior to the pandemic. There are multiple standards. There are several different idiosyncratic requirements by different payers or business lines that just cause a lot of confusion at the individual provider level. That's magnified when providers are independent, when they're not part of an employed medical group model, for example. It's almost overwhelming how many standards they're faced with. So I think one of the positive aspects of this pandemic has been the overwhelming necessity to simplify and to relax standards and allow telehealth usage to be deployed more rapidly. Now, when the pandemic first started, and we didn't see, a tremendous problem with workforce being incapacitated. The second problem that arose in April was the sudden realization that the lockdown had caused a lack of patient volume for the brick and mortar inpatient visit model. And this is when we started to think about not only telehealth adoption, but eConsult adoption as well, and had a number of calls with Blue Pass Health, a number of discussions with vendors about how this could be done. I'll use one of my organizations as an example. UCSF Children's Health was a very early adopter of the eConsult model and found a very interesting way to do it. So I spoke earlier about physician reticence to adopt telehealth or eConsult. One of the problems is that physicians in independent practice view eConsult as probably a lower reimbursement model than they would normally see for inpatient or for referral practice. But of course, with the lockdown, you had no patient volume. And so there was an interest then to devise ways to deploy eConsult. UCSF was very innovative. We got them connected with a health plan who was located geographically across the state from where they are. And this provided a good model that I think we could emulate across the state in other areas as well. So you had Bay Area physicians rendering eConsult to primary care physicians across the state, several hundred miles away. So it was improving access in rural areas. It was improving access to specialty consults for primary care physicians. And it was providing independent specialty practitioners with a source of income during the downturn that occurred in April and May. So it turned out to be a win-win. We tried to publicize this across the state to see whether we could get other organizations to adopt this. It seems to be the least disruptive way in which to do this when you're deploying eConsult within a network. So there are some other issues around eConsult from the provider perspective. One is that we still have a lot of hurdles around regulatory acceptance of the model. It needs to be regarded as beneficial, as a means to deliver better patient outcomes over the long term by increasing the consultations between primary care and specialty and allowing primary care to deliver a maximum amount of services through that particular channel, as opposed to just referring patients to other specialty offices. It grinds against current regulatory structures that require multiple visits, check the box kind of approach to how we deliver patient care. And so I think over time, as we prove that eConsult actually increases coordination of patient care and improves patient outcomes, we might see some better regulatory acceptance of the model as well. I think from the provider's perspective, the expansion of the geographic reach of their practice is a tremendous asset in times like these where you've got patient lockdowns to deal with, where you might have issues around not being able to accommodate both sick and well patients within your office setting. And this prospect of having more ready access to specialty consultation when you're at the primary care level. So I think that's a good summary of where we are at the current state with providers. And I'll turn it over to the next panelist from here.
Thanks, Bill. And we know you'll be around to answer a few questions a little bit later on. So next, I'd like to introduce Abby Totten. And Abby is the program officer for California's Medicaid program, known as Medi-Cal. And with HealthNet being the largest of all of Centene's health plans of all 50 states and serving more Medicaid members than any other state, I know that they are the plan that the rest of the states are all looking at. So Abby, let me turn it over to you.
Yeah, thanks, Greg. And you know us well since your days at Centene. So for HealthNet and California Health and Wellness, we have been longtime adopters of the eConsult model, largely driven by our rural markets for California Health and Wellness, where there really are not readily available specialists within the geography. And so across the market since 2016, we've implemented approximately 100 clinic sites that have provided over 7,000 eConsult visits. And we have really done so for a couple of specific reasons. One, the value of eConsult is something that we believe is not only proven, but will continue to prove out over time as being an ideal way of streamlining the clinical care experience for a member. So for most members in the Medicaid program, the idea of having to set up a primary care visit, to go in, to receive services, and then have to do subsequent follow-up appointments is a difficult prospect, because not only do they have to take time out of what is likely a job that does not provide for the time off that is necessary in the middle of the work week, but they've also got to set up transportation. They have to deal with, you've got children, you've got other much more important aspects of daily life than simply making a physician's visit and getting into care. And so what we've seen over time is that for Medi-Cal Medicaid members, they have a high no-show rate at specialty clinics. And so what happens is specialists become less and less willing to see Medicaid members because they do not believe that they have the incentive to show up at those clinic visits, those specialty visits, and follow through on their appointments. And so as a way to ease the burden for our specialty panel and bring access to rural markets, we've expanded these eConsult visits. And what's been fascinating to see over time is we've had more than 2/3 of those eConsult visits be able to be cared for within a primary care site, meaning that individual likely would have had a specialty care visit that would either be unnecessary or really within the primary care scope of practice. And as a result, we've been really pleased to see not only are we able to slowly bring down the overall cost of care, but it improves the member experience as they are more likely to complete that full cycle of care and improve their health over time. And so we've continued to support the rollout of eConsult. One of the most important aspects of a good eConsult program is really the clinical leadership behind it. As Bill had mentioned, it is not an easy task to change your workflows within a practice to identify those points within your administrative system that the eConsult system will be integrated. And so with really good physician leadership that believes in the value of eConsult, not only will a practice take the time, but they'll feel like they have the incentive to move forward with eConsult. And it really can provide for additional satisfaction for a physician as well, who's able to maintain that individual within their practice rather than sending out for care. What we've also found is that for specialists, not only are the no-show rates lower, but when somebody shows up to a visit, even if they've had an eConsult in advance, they're much more prepared for the visit itself. So instead of having a patient walk into a specialty visit without the appropriate documentation, without the pre-work done on specific tests, each patient comes in fully worked up and ready for that specialist to assess in true clinical form. And so we really believe that not only are we driving better patient outcomes, but we're improving satisfaction at both the primary care and the specialty care level. This is really important for us because we know, especially now more than ever, that our physician workforce is struggling. We were struggling before the pandemic, where California was already running low from a physician workforce standpoint. When you add into that over 1/3 of our physicians are over the age of 55, and we don't necessarily have a quick pipeline to push more physicians into the market, we've got to be able to maximize the practice experience and maximize satisfaction. With the COVID pandemic, our biggest concern is really not workforce as we knew it before, but where's our workforce going to be in the future? Because as we sit today, we're seeing higher rates of PTSD, we're seeing physician suicides, we're seeing physician burnout like never before. And without a clear end of the pandemic in sight, although we're all hopeful that it won't be too far along, we have to make sure that we're going to protect our workforce now and into the future. And we really believe that as we move forward, rolling out these additional opportunities to maximize the practice, to simplify the patient experience, to improve outcomes is where we're going to have to go. And technology solutions are going to be the backbone of that approach. Because we can't, as I said, we can't grow more physicians. I wish I had a physician tree, as I'm sure most clinical practices do. We could just gain more specialists by, clicking our fingers. But in reality, it takes a lot of time and effort and patience for someone to move into the type of clinical specialties that we really are desperate for. And so we will continue to support eConsult. Some of the things we're working on now include incentive agreements with our clinical practices to help them with the upfront and long-term costs of implementing eConsult, making sure that we're providing for administrative support for those implementations, and really making sure that they have the resources within the plan to support them on the go forward. So we really believe in the long term, this is where we're going to have to go in order to support our patients and our physicians, and that this is just really the beginning of a long evolution in healthcare that's going to result in lower costs and better outcomes. And with that, I will pass it over to my colleague Joel to talk about his Anthem experience.
Joel, so we'll let you tee you up, and Joel being part of leading the Medicaid efforts at Anthem Blue Cross in California, and he's ready to tell us about the really exciting collaboration that they're engaged in.
Great. Thanks, Greg. Can you guys hear me okay? This is the unfortunate thing, I guess, of going last, because you guys took all my talking points. So I think I'm going to go a little off script here. And Libby, I think you're also going to bring up a slide deck when I'm ready to talk a little about what we're trying to do. Yeah, so since I have 10 minutes, I think what I'll do instead, I'll talk a little bit about the experience, I think, that I've had to go through having a very close family member on Medicaid that I have to navigate the system through kind of on a regular basis. So I kind of get this perspective that everything we're talking about today and the specialty access challenges in Medicaid, it's very personal for me, and I struggle with it as an executive in Medicaid. I can't navigate it very well successfully and have challenges. So it's one of the reasons why I actually became really passionate about this concept or this topic here that we're talking about now today, the eConsult solution. So, my family member, and this is like one of probably dozens of stories that I've gone through in specialty access, but we'll just say a basic dermatology consult. You start Medicaid, we all understand how HMOs work. You have to get a PCP referral to see a specialist. So you get that. So we got an authorization to see a dermatologist, and should be as simple as calling up the specialist then and making an appointment. But you call the specialist, and the office doesn't have the authorization in their system. So that leads to many round-trip phone calls with your medical group or your IPA. In this case, there was a PMG and an IPA involved, and clearing up what is that authorization issue, what's going on, then calling the specialist and making sure, do you see the authorization yet? And that actually took weeks to get it resolved. And this family member actually has some pretty serious behavioral health, mental health type issues, and just would never be able to navigate any of this stuff without, say, my help as a family member. So you get the appointment, right? We got the appointment, and after about 2 to 3 weeks working on an authorization issue, and of course, then the appointment's about 2 months away. Sometimes I've seen it as high to 3, 4, 5 months away. So you get that on the books, and the day comes. This family member that I have normally needs transportation services, and she's actually missed that transportation many, many times. So you wait this long, you go through all the hassle of getting it all set up. Don't come out the door within 5 to 10 minutes, transportation leaves, and then you kind of have to start the process often all over again with a new appointment. And in many cases, I actually take her to the appointment. So I actually went to the clinic to see the dermatologist. And after waiting there, and we were called up to register in, she had forgot her ID. And just simply forgetting an ID was enough to say, we can't see you, you have to be able to show your ID. And this actually kind of surprises me. It's the first time I've ever encountered this, and hopefully won't experience it again. But she's a senior, didn't have her ID, again, has memory issues, and did not have the ID, and they refused to see her. And we sat there for about an hour and tried to complain and say, how long we had been waiting for this appointment. It's just for a basic consult, actually, for a pretty serious skin condition. And there was nothing we could do. They said no. So they actually refused service, and we missed that appointment and then rescheduled it again. Again, probably about, I think it was another 2 months down the road. She didn't go to that one after that, kind of got jaded by it, didn't want to go, and her condition had continued to escalate. And she actually did go to the emergency room a couple of times. This is kind of like everything that we're talking about, I think, today, like what Bill was just speaking to, Greg, Chris, Abby. It's unbelievable. And multiply this, I think, times, the hundreds of thousands of people who go through this every year in Medicaid. And it's unacceptable. However, she had the option if her PCP had been enabled to maybe work with a dermatologist directly on her condition. Maybe all this could have been avoided. I'm not sure. But I've read a lot of stories. I've seen a lot of case studies on this, and it definitely seems to really strengthen our primary care delivery system. And Abby, as you said, it's like there just aren't enough specialists, especially in Medicaid. And I really think eConsults could be a solution. I remember there was an article I read that can eConsult save Medicaid? I think that was a white paper study, and I think it involved CHCN, and it was just fascinating to read because it's like, yeah, it is sometimes that dire, and I really think eConsults can make a really big difference. So, I think we're always going to have these challenges in Medicaid. You've heard a little bit about why, this is important to me personally, but I've heard from a lot of the FQHCs, the safety net systems, a lot of their leadership that during COVID, and Bill, you spoke to this, it's actually gotten even more worse. It's actually more difficult to get a specialist during this pandemic in our Medicaid system. So I've been seeing a lot of providers saying, if we had eConsults available to us, we would definitely do our best to integrate them and leverage them as best as we can, especially with what we're seeing with specialty access shortages during COVID. And so how are we doing this now? As a health plan within Anthem, we're a large Medicaid health plan, 1.2 million members. We're across 29 counties. So we really wanted to try to expand the adoption rate as much as we can as a health plan. What can we do that can make a difference? We started in El Dorado. El Dorado County already had a pretty strong eConsults program set up with one of the major FQHCs there, El Dorado Community Health Centers. So we started there and said, you know what, we're going to do our own contract. We're going to get those stood up and make sure that this FQHC, which before was only doing eConsults for essentially 1/2 of their membership, was our competitor who had already had eConsults stood up, but they weren't able to do it for their other population, the ones that were with Anthem. And again, that's unacceptable. You really have to have the whole population or the whole patient population for a clinic be able to benefit from eConsults for it to really be adopted. It can't just be bifurcated or separated between the two health plans. So we did that in El Dorado, and then we were looking at other opportunities, and then of course COVID-19 hit, and we've been in this pandemic. So one of the things that we did, which I think was pretty neat, and we've seen some adoption on it, is we just opened up a portal that said any doctor in Anthem Blue Cross Medicaid that has a patient that they want to do an eConsult, they can just go to this website. You just create a login, and you can send it as a secure message, no technology needed. You can go ahead and send the eConsult in and get a response back from a specialist, and Anthem will just pay for that directly. It was kind of a response to COVID-19, and I've heard from a lot of physicians that they appreciated this because it just made it easy for especially some challenging cases, not even to worry about who do I go to get this eConsult paid for? Do I go to the PMG or do I go to the health plan? Just go to the portal if it was an Anthem Blue Cross member, and we would cover it. And so that's been, I think, really, really great. But where we're at now is we really want to start seeing eConsult adopted across an entire county, right? So California's Medicaid system is basically structured into actually 6 different models, as most of us know. I think the majority is the 2-plan model, where there's a local initiative and a commercial type health plan. There's also some other models, but it's pretty much county by county. And so how can we go into a county and really say across the board this is going to be adopted? We saw Inland Empire Health Plan actually announce that they were going to do that. I think by 2021, eConsults were going to be essentially mandatory. Not sure we want to take that approach, that word mandatory, because there's some challenges, I think, with that. But how can we truly build a county-wide adoption where it's very collaborative? And so you can kind of see some things on this slide is to transform specialty care through eConsults and really say, pick a county as maybe a pilot, work with the other health plan, and essentially say across the whole delivery system of Medicaid, eConsults becomes, and I'll just quote here, the first step towards a routine, non-urgent specialty referral across the entire county. So we actually engaged Blue Path, who's been extremely great partners on this. We've been talking with a local initiative health plan, commercial counterparts, including Abby and HealthNet. And this is kind of where it's like we have to put away our competitive. I know we're all competitors, and that's one thing to account for. But when it comes to eConsult, it just doesn't work very well at a county-wide level unless all the stakeholders come together and agree. We're going to go ahead and do this from the top here, where there's like the reimbursement model, the payer, working with our PMGs, our IPAs, and Bill has been a great partner, having a lot of discussions about that. And then, the FQHCs, the safety net health systems, independent doctors that work in Medicaid, specialty groups, even hospital systems, get everyone to the table and let's just go ahead and figure it out. So we can say, starting this date, we're really going to go live across the entire county. And if we can do this, health plans can come together, the whole county can come together and make this happen. I think we could start really rolling this out to other counties very quickly. And the challenge, I think, to all this is Bill, you said it, the regulatory environment. I can't say it better than you can. But I do kind of have this opinion that if we build it, then we'll be able to prove it to the state. I think it's going to be really tough to try to get the state to figure everything out, to get DHCS to pass all the APLs and everything that we would want to say, how does eConsults fit in our time and distance standards and all our network compliance standards? I think if we can actually show them that we did this as an industry and we got it done, and then show them how it's benefiting members from an access perspective, I think that will really give us the support we need to get those that regulatory guidance that I think we all need. So I think I'm going to go ahead and stop there because I know we're looking to have some Q&A. So I don't know if I give some few minutes back, but Greg, I'll hand it back to you.
Great, thanks, Joel, and thanks for sharing your personal story. I think we all have stories to tell, and as we think about how the whole healthcare delivery system affects us, our families, and our loved ones, and those that we're actually working with, there's a lot of stories to tell that, as we look at, we're serving individuals who live in families, who live in communities, and so thanks so much. And just like to remind people, if they have questions, please send them in via the chat. And so I'd like to start with a question for Bill. A question came in from my friend Sean Atha, who said, what about restructuring the cost, the whole cost structure? You heard Joel talk about Anthem saying that just go ahead and sign up and Anthem will pay for it. But most commonly, the cost is attributed to the medical group that's providing the services, and yet the health plan is often accruing some of the benefits. Can you talk a little bit about how you view that, Bill?
Yeah, I tried to explain that in my comments, and good morning, Sean. Good to hear from you. Thanks, Greg. I think it's been easier for a capitated, delegated medical group to adopt eConsult within its network when it's providing the services out of area. And I use the UCSF Children's as an example. And the reason why I say that is because when you're in area, as Joel mentioned, let's do this within a county. And I think from a clinical standpoint, yeah, you would get the most bang for your buck by doing it all within a county, but it's very complex in terms of figuring out how to arrange the payment model. So if you want to speed up the adoption of eConsult, get providers on board, get them used to doing eConsults as they become used to doing telehealth in general. I think the UCSF example is really telling. By providing the services out of area, their providers are not cannibalizing their existing in-person practice. This is an added business model for them, and it makes sense because they can provide additional services across the state. It does also introduce some level of competition across the state as well when you've got providers that are geographically remote also providing services within a specific geographic area as well.
Thanks, Bill. We have another question coming in from Michael Fratkin from Resolution Care, who poses an interesting question. He said, can we use eConsult as a way of refining the fit for referrals to palliative care? And so, actually, I'm going to use that as a toss-up between Abby, Joel, and Bill. If any of you have experience of using eConsults for palliative care specifically, or your thoughts on this topic?
I'll take it first. I do recall a discussion with Sutter a couple of years ago, and I think they do incorporate some level of this practice in their palliative care services as well, but I don't know details.
Yeah, I think that is actually a really good call out as a potential opportunity. I think we have been really working to expand access to palliative care because it's such an important benefit for our patients. I mean, I know from many of us who've seen family members go through long-standing cancer treatments and have had to deal with, continuing to maintain their health or seeking, it may eventually become end-of-life treatment. Having the type of support that palliative care gives very early on in the process has an incredible benefit. And so I think it's a great call out, and love to talk to folks who are interested in finding those pathways, because I do believe in giving the physicians the tools, including palliative care, is going to be so important. And especially, again, as we sit in the pandemic, the use of eConsult as a way to do that makes a lot of sense.
Mm-hmm.
Thank you.
Yeah, and I can add, a little bit of context to that. I was actually struggling with that one because I know, so Anthem in our Medicaid plan, we had access to, I don't know if I could call it necessarily an eConsult, though it does definitely feel very similar to a service through Aspire Health, which we actually acquired. For some of those who may recognize that name. A couple of years ago, but I mean, it's basically telephonic based, where a member can essentially call a number and get the kind of, I know it's not doctor to doctor per se, though it could be, but it's very high touch, and it allows both providers and members to essentially refer in, to call someone, talk to someone, get triaged, and get the care that they need for palliative services. So it's kind of a blend of an eConsult, if it's the doctor side, if it's a little bit on the telehealth side. But yeah, I mean, I've heard nothing but good things about having that kind of ability to just pick up a phone and kind of get that referral coordination, care coordination, all that for palliative care.
Great. Each of you happens to be based in California, but you also have a national perspective. And Abby, let me ask you, with health with Centene being in, I think, in all 50 states now, how do you move the concept and get other health plans across the country and other states to embrace eConsult that you see working so effectively here in California?
What's interesting about California that's very different across all the other Centene plans is we're highly delegated. And so, there was a question about where savings accrue for eConsult, and where we've really seen the savings is not necessarily on the inpatient or the ER side, but it has been on the specialty care side. So in fee-for-service markets, it makes a lot of sense, and you can easily prove the cost savings and the importance of the investment. And so in many ways, it is simply looking at the numbers. It's the time and the effort to implement the programs results in the savings. But the real key is getting the physician level buy-in. And that is, I think, to Bill's point earlier, a much more complicated conversation. And so it's really, as a health plan, it's important for us to help provide the tools to implement the change and to be there to support its integration into the overall workflow of a practice. Because if you're forcing a practice to move forward with something that is outside of its normal workflow, it's just not going to stick. And so that's where we as a health plan can provide to other health plans within the Centene markets best practices. This is what we've done. This is how we've approached it, and really developing the plan-to-plan toolkit to get the physician-level buy-in, because I think it is so simple just from a numbers standpoint to see the value of taking an eConsult approach.
Thank you, Abby. You know, just in this brief discussion, we've heard a lot about regulatory challenges. And Bill, in your role as an EVP for Government Affairs, do you have any tips for the audience about how best to engage the, the individual states, CMS, whoever's out there regulating us, and give us the, the secret sauce of how to influence them to, embrace the concepts of eConsult?
It's a real challenge, and I think the only way we're going to win the battle is through data, is through showing regulators that this is a practice that presents a better, more efficient way to improve patient outcomes. But of course, that's a chicken or the egg situation, right? You can't do it if you don't have regulatory authority, and you can't get the data until you have that. And so it's been a start and stop kind of experience here in California, less so in other states, I think, that are a little bit more relaxed about their approach. So that's an example, is a national organization like ours could use out-of-state data to try and make the case as well. Let me borrow some comments from Abby and Joel, though. I mean, especially in the Medicaid sector, we're facing so many problems around network adequacy that it almost forces the regulators to consider being more flexible. And I think that's one of the great outcomes that we've seen in the pandemic, is that federal regulators have been willing to relax a lot of rules around telehealth in general. And someone made a comment to me the other day that, these last 7-8 months have proved that the relaxation of the standards has not resulted in any diminishment of quality. It's actually improved efficiency and quality in delivery of healthcare. And so that's a great starting point to advocate for these new rules.
Yeah, so I think it's important that we highlight it's important, to partner with our regulators and keep that discussion open, that dialogue moving along. And Joel, maybe for final question, you talked about the collaboration among competitors, that co-opetition. What kind of tips can you give to the plans that are, on the call right now and at the meeting, about how do you start those discussions, and how do you keep those discussions flowing to the point where you and your co-opetitors, whatever the word is, how did you keep them engaged and come up with a successful result?
Yeah, hire Blue Path, and your problems are solved. No, just kidding. No, but in all seriousness, I really do think having a neutral third party as a tip here really helps. I think it's tough for one health plan to just go out to the other health plans or the other systems, including your hospital systems, your local provider groups. I really like, what we were talking about is how do you engage providers that may want to keep eConsults in their ecosystem, right? So that it's all within the same system. And we're talking about that as well. So I think, having a third party that can bring everyone to the table to kind of take away any thoughts that, oh, what's in it for you kind of thing. It's like, no, let's get a third party. Let's all come to the table. Obviously, we all have our own interests, and we want to talk about those and be very, very transparent about those. But I think that really helps. And then, Abby brings up a really, really good point. In Anthem Medicaid, I think about 70% of our membership is delegated through an IPA. This is no secret. This is very true of a lot of health plans. A lot of the membership is delegated. And I think figuring out that reimbursement challenge can be a challenge. I know some IPAs and physician groups are reimbursing for eConsults directly, but many are not. And for a lot of them, I understand why. eConsults are new. Even the reimbursement codes, recently just came out from DHCS. I think that was just in 2019. So it kind of makes sense. So I think you got to have to look at it and say, as a health plan, do we just go ahead and pay them now, and then look at how much that expense kind of is versus the potential improvements to both quality and cost, and kind of prove that out. And then during renewals with IPAs and PMGs, kind of bring that data to the table and then talk about that. I think from a health plan perspective, we always hope that our physician groups and IPAs will take on reimbursement and payment for eConsults. But again, if they won't, that doesn't necessarily mean, I think sometimes we get in this habit that says, oh, we're already paying capitation for professional services, we can't pay for eConsults. I think I know we're starting to challenge that, and I think other health plans need to take a hard look at that and say, is it the right time to at least start piloting and start paying for them directly if we can't come to an agreement on reimbursement through the IPA type model? And then again, maybe true up it later and talk about that later if necessary, and really prove out over a year or two how much of a difference has this made. And that's risk-taking, but I definitely think we're at this point in time that access is such a challenge that we really need to think outside the box and maybe take a different approach on things.
Yeah, well, thinking outside the box, I don't know, we're not going to have time to answer this last question, but I'm going to throw down the gauntlet for not only the three of you, but for everybody else on the call. Question came in from Eli Santiago at Tulane, another friend of mine, that says, do you see an opportunity for an increased national adoption of eConsult to open the healthcare borders across states and equalize healthcare access and quality to address disparity and decreased access? So, I know we're looking at it from our parochial perspectives, but thank you, Eli, for challenging us to look even bigger. And with that, I'm going to thank each of our panelists. Thank you, Bill, Abby, Joel, for the stimulating discussion, and I'm going to turn things back over to Libby.
Thank you, Greg, and thanks for moderating perfectly to the 10 o'clock hour. That's impressive. Not everybody has that skill. I really want to thank you, Abby, Bill, Greg, Joel. These are just great examples of that co-opetition, that word that's hard to say, and we really love the fact that you can share how this is done, and it's past the point of competition to the point of making this easier for our patients and providers. So thank you so much.